The Omicron variant of COVID-19 has cases spiking around the country, including here in Washington state.
We're seeing a lot more positive tests.
Dr. John McGuire is the chief of Pediatric Critical Care at Seattle Children's. He says Omicron appears to cause less severe illness in children than previous variants of the virus.
Fortunately, this is not correlating to an increased number of kids coming into the hospital. When we saw the Delta wave come into our region in August and September, we saw a big increase in number of cases, and we saw a big increase in number of kids needing hospitalization.
Data from the State Department of Health backs this up. According to the most recent numbers reported from DOH, on January 2nd, the 7-day COVID-19 case count for kids ages 0 to 11 was more than 4,200. In that same time frame, there were 28 hospitalizations for kids 11 and younger. And if we look back to when the Delta variant was spiking, on September 2nd, the 7-day COVID-19 case count for kids ages 0 to 11 was 3,003. But the hospitalization rates were like what we're seeing now at 23 for kids 11 and younger. But Dr. McGuire says parents should stay vigilant.
The last 2 weeks have really spiked up. So I think it's early to say don't worry about it. We still recommend that people get vaccinated, that people are cautious around using masking and avoiding settings where they're likely to be exposed, and to test if they have positive symptoms.
And Dr. McGuire wanted to add that with most kids returning to classrooms this week after the holiday break, they are anticipating a big spike in cases among kids. He did say that this is something, though, that Children's Hospital is preparing for. Live in Seattle, Kayla Lafferty, King 5.